Hey, what's going on, everybody, and welcome to our Spotlight series. I am here with my good friend and Arte brother, Mark Baldwin of HydraMed. Mark, how's it going?
It's going good. Thanks for having me on today. I really appreciate it.
I appreciate you being willing to come on, dropping a ton of value. And we even had some interesting conversations before we started, which I want to touch on. But tell us, what got you into this business? Like, why did you start your own business?
So it's not the first business that I've had. I've always had that entrepreneurial mindset. This business in particular for me, I'm pretty big into health and fitness, and I'm very concerned about what goes into my body, human optimization, things like that.
Mhm.
And I just saw an avenue where this industry wasn't being utilized correctly. Being mobile IV therapy, everybody assumes we're the hangover company, right? And that's all we do, and that's all we take care of. And really, that accounts for less than 7% of our business. It's optimizing what the human body can do when it's provided the right nutrients and right vitamins to function properly. And we saw opportunity where nobody else was really diving into a lot of this, and that's where we got started 4 years ago.
That's awesome. And let's talk a little bit about some of the growth there because you've had some really, really fast growth.
We have. So we started right at the beginning of the pandemic, which originally turned out to be pretty horrible. We had a difficult time getting supplies, supply chain issues. All the medical supplies were going to hospitals and urgent cares and nursing homes. So we had a little bit of a delay, but because of COVID, it was huge for our business. You know, we were talking about things that we weren't allowed to talk about at the time, like natural immunity and how we can take care of ourselves and how the body can function without vaccinations and all this other stuff, right? So we got in a lot of trouble initially with like Google and Facebook, and we got censored and all that kind of stuff. But when people really look at what they can do to themselves to take care of themselves and help boost that natural immunity, I mean, we exploded. The second part of that was when everything else was shut down, as a mobile company, we were still able to go into people's homes and treat and take care of them. So a lot of like naturopaths and functional medicine docs and oncologists, they saw the benefit of a company like ours having that ability when they couldn't get patients into their home themselves. So yeah, so we started out, we're just over 3.5 years. It was myself, my business partner, and we had 5 medics and nurses working for us in Colorado. And now we're in 6 states with a staff of over 85 and treating people in home. And it's a growing, expanding business. It is more than just like I said before, the hangover stuff. It's truly a path to health and wellness that, a lot of people explore and more people should be exploring.
I'm huge into that. I've had my cold plunge for a year now. It's worth its weight in gold.
Yep.
All right. So can let's talk about not the hangover stuff because that's the stuff you get in Vegas and like you said, it's not a big part of your business.
Right.
Let's talk about some of the other things that people might not be aware of that you guys do and how they can optimize their bodies.
So the big thing with IV therapy in general, whether it's brick and mortar, mobile, whatever it is, it's how you get the vitamins, right? So anytime you pop a vitamin or a pill, whatever, it has to go through the gut. It has to get digested, all of that. And so like vitamin C, for example, when you take a vitamin C tablet, you really only get 20, maybe 30% of that into the bloodstream. So if you're taking 1 gram of vitamin C orally, you're really only getting 2, maybe 300 milligrams of that actually makes it into the cellular space to help with the immune system. Where IV therapy, you get it's what's called 100% bioavailability. That means if I give you a gram of vitamin C IV, you're going to get that full 1 gram vitamin C that's going to make its way into the cellular space right away. Right. So now we're not spending money on a lot of stuff that's not working. And not that it doesn't work. It's just not as effective as people think. It's like, oh, I'm getting a gram of this. No, you're really not. So it's a big difference. In almost every vitamin and nutrient that we provide, it's like that. Well, I take this and I take this. Well, that's great, but studies show this is really only what's making it to the bloodstream, right? And it's such a low percentage where instead of maybe popping a vitamin or a pill or something every single day, every 2 weeks or every month, we do these big immunity boosting IVs where you're getting all these nutrients. Now, granted, the body can only take in so much at one time, But to be able to flood the cells with a lot of that right away, that really helps boost the immune system. It alleviates a lot of that need for daily or monthly, week, whatever it is, vitamin wise.
Mm-hmm.
So there's a lot of benefits. The majority of our customers that we see are people that are on either an every 2 week or an every month schedule where they're getting these immunity boosting type vitamins. And then obviously, a big part of our business too is when people do get sick or the cold and the flu. Our big thing is, we don't treat or cure anything, but what we do is we help make people feel better a lot faster. So like our COVID rescue bags that we have, our food poisoning, things like that. It's, you could go to the ER and you could drop a ton of money, but I can give you the same thing in an IV in your home for a lot less than not dropping money on a deductible. So, the biggest part is our patients we see on a regular for the immunity boosting, but then that health and wellness, that I'm sick now and I need more of an urgent care type treatment. We're great at that.
Yep. Well, think about it like this, right? Even if you don't know the science behind everything, anytime I've ever taken a multivitamin and you go to the bathroom, you see the difference.
Right.
You're peeing it out. You're peeing it out right away. So, I mean, it's just, you see it, what are some of the things? So you said you have a flu, a flu drip. What are some of the options that you have just besides the immunity booster?
So along with the immunity boost, I mean, we do have, like, for our more acute patients that need something right away, we have, which is big in Colorado where I'm at, our altitude sickness. That's a big one here. We have health and beauty glow. We have products in there like Biotin and glutathione that help with the skin and the hair and the nails and all of that. We also carry products that help with post and pre-workout. We have a number of athletes that we take care of. We do pre-workouts or pre-race day IVs for them, give them that little extra boost, and then we'll go meet them at the parking lot of wherever the race is, and we'll do a post-IV therapy that's, magnesium and glutathione and Toradol, right? Things to take out inflammation and calm the muscles down. It greatly enhances their recovery time, so they're able to get back into working out or exercising or whatever it is later. Our basic, the Myers cocktail, the standard since the 60s, right? Just all the nutrients and vitamins you need just to function as a human, things like that. And one of our biggest products, the most popular one we do now, is our NAD products. So it's a coenzyme that's in every cell in the body. The older you get, the less of it you make. And that's the reason why when you get older, you get more tired, because NAD is responsible for working in your mitochondria, activating all your ATP stores. And if you don't have NAD to do that, you don't do it, right? So the body has to be supplemented with that stuff. And really the best way to do that, if you look at that bioavailability scale again, is obviously IV, because it gets right into the cellular space. It activates all 30 trillion plus cells in your body at the same time. And it's just complete rejuvenation, cellular rejuvenation. It's called the brain mind type, because it helps with inflammation. It helps with thought and cognition. We have a number of different patients, Parkinson's, MS, right? We're not treating or curing those things, but what we're doing is we're greatly relieving the symptoms they have associated with those afflictions. So NAD by far, and it exploded for us, I guess it was about a year ago, when, I don't know if it's the Kardashians or whoever did it on TV, right? They made it popular, but they made it popular for all the wrong reasons. Yeah. So it's nice to be able to educate people on why they should do it and what the real benefits are and why it's necessary in the body.
I love it. I actually take NAD, but I have the injectables.
Yep.
What is the difference? And this is a personal question, and we're live, but I don't care. I'm an open book.
Yeah. So it's really, it comes down to bioavailability. So I do both. So I do a monthly NAD drip, right? Because it goes in and it's cellular regeneration. What it does when you're doing it at IV is it literally goes in and cleans out the cells. If you really take the root cause of almost every disease we're afflicted with, take it all the way down to the root causes, it comes from two things. It comes from oxidative stress and inflammation. Well, NAD is one of the few things that takes out oxidative stress and inflammation from the body. and then a boost of glutathione, because glutathione, as your master antioxidant, helps get all that out of the body. So IV. So when you get it IV, that's 100% bioavailability. The next option, and which would be the next best option then, is like sub-Q treatments. So if you're doing it sub-Q, anywhere from 50 to 75 milligrams, once or twice a week, that's shown to provide 70 to 80% bioavailability. IM shots, that's closer to 50, 60. And then, they have nasal spray, they have patches. We're not big on the patches. Our pharmacy and our pharmacist doesn't really agree with them. But, any kind of dosing of NAD helps. It's just getting it in the most valuable way. I like doing the shots. So I do the big IV once a month, and then twice a week, I do 75 milligrams sub-Q.
Mm-hmm.
And for me, that was a game changer 4 years ago when I started doing that at 50, because all of a sudden I'm not dragging in the afternoons. I don't feel like I need to go take a nap. I felt like I could think faster, clearer, more effectively, and just overall health. My biggest problems obviously was I've had a lot of injuries over the year from a lot of sports. And shortly after starting that regimen, I was able to go out and throw a ball with my boys without having to come in the house 10 minutes later and take a mouthful of Advil and ibuprofen and Tylenol because my shoulder hurt so bad. It alleviated a lot of that, and it's getting the inflammation out of the body. So, it kind of fits whatever. I have patients that they'll only do the sub-Q because they don't like the feeling of the IV. IV is really hard to take because when you activate all 30 trillion cells at the same time, it's a big workout for the body, and it can be very stressful. But then I have people, they can't give themselves shots. So they're willing to do the monthly IV. And the more you do it, the less those feelings, kind of precipitate the treatment. But either way, they both show a great amount of benefit to the body.
Yeah. I have yet to do the IV, and I haven't done the IV because of the time.
Right. That's a 2 to 3, 4 hour drip, depending on the dosage that you do. So,
yep. And if you go faster, my friend who is a doctor here basically said it's going to feel like you have an elephant on your chest.
Yep. Yeah. So how I describe it to my patients is, imagine having a really horrible hangover. You just took a big, powerful pre-workout and you have chest pain the entire time. Yeah. It's titrated to effect, right? So we slow the drip down. 30 seconds after the drip is done, all those feelings go away and you feel amazing. So it's a process, but our nurses and medics are trained in how to do it and do it properly to make it as least uncomfortable as possible for the patient.
Yeah, I mean, he's told me, he goes, because I told him about the time, and he goes, well, listen, if we go fast, it's going to be more uncomfortable. If you go the normal route, you should be fine. I'm like, okay.
Right.
I don't have time for the normal route, so just give me the shots.
And I have patients that will say, hey, let's push it. Right.
Yeah.
They think it's a mental thing. They can overcome it. It's not. It's a complete physiological effect in the body, and you have no control over how that happens. I don't care how mentally tough you are. Yeah. You can't mentally out tough this. So just hold on for the ride.
Well, what are some of the other things that maybe we didn't cover so far?
So as a company, we're pretty forethoughtful in where we're going in the future. One of the big things we just started here in the Denver area that we're getting ready to expand into our Florida and Dallas market here soon is we're going to be offering mobile HRT treatments, so mobile pellets for men and women. I'm kind of big into both, especially for men. I like the pellets. I like the company that we use out of Dallas because it's based on your cardiac output and how much of either the testosterone or the estrogen that it pulls out into the body for use. And for me, that's, and a lot of people, you get a pellet placement once, or 2 or 3 times a year, and that's it. Instead of doing a shot, some guys do it weekly, some guys do it twice a week, right? That's a lot of shots to take. So, but to get a pellet placed and then do it once and forget about it for the next 5 or 6 months, that's huge. So we're moving into that arena as well. That's been a huge market for us. It's a huge benefit. The big part of it is being mobile and being able to do this in people's homes. The COVID taught us one thing, is that we don't need to go all these places to do all these things. And now people are expecting that kind of service and treatment, right? So we're going back to medicine the way it used to be. People coming into homes to take care of people, to do assessments, Telehealth is obviously much larger now, right? We can have these video conferences and these discussions between the provider and the patient right there. We have national contracts with a number of different blood testing places where they can go do it. We can ship it to their home. Literally, the patient never has to leave their home to be able to get these treatments. If the treatment is, say, shots or pills or whatever it is, that can all be shipped. It's a good assessments are still done, right? There's things that our providers still go out and do. So it's not like we just completely, abandon a lot of that with telehealth. There's still personal visits. There's still one-on-one touch with the patient. But as we continue to grow in that space, more mobile products and services that we can offer. And for me, the hormone aspect is huge. I don't think it's talked enough about. I think people have a bad thing about it because there have been these very random studies about, well, testosterone gives cancer, and oh, well, that's great if you're a bodybuilder. Now, if you really look at what like testosterone does for men and women, if it's too low, you're looking at cardiovascular disease, which is heart attack and stroke and all these other symptoms that you're going to be suffering from. There's no reason that you need to be 80 and feel like you're 80. The body can work just fine if it's done and if it's done right. So, it's educating people on what we do and how we do it. And I saw the results for me personally. For my wife, it was huge because insurance only does so much. And, we have Kaiser, which is great, but we got to a point after she had some medical issues. Well, this is all we can do for you. And then we really started diving into the hormones and all that Kaiser would not do. And it took about almost 2 years, but to get her dialed in, totally different woman, totally different experience. So 75% of our customers on the hormone side and the pellets are women. Women are the hardest to get dialed in. Men is easy, right? Let's find out what a test is. Let's see where your labs are for all these different things we have to check before we start giving that stuff, right? And then here's your dosing, and guys are usually pretty good. Maybe they need a little estradiol or something else, but that's easy to take care of. Where women, we have all these different issues that they have to take care of, and it takes time. It's not, hey, take this and you're done. It's take this, how are you feeling? All right, let's see what your blood work looks like. Okay, let's try this. Right. But most patients within 12 to 18 months, they're getting dialed in. They feel pretty good. They're healthy, right? They're living a better life. Our big thing in our logo is live more, age smarter. There's no reason for a lot of people to suffer. And my big thing is be your own advocate. Even when you're going in to see your own physician, or if you come see one of our physicians or one of our nurses, right? Be an advocate for how you're feeling and what you want to accomplish. And don't just say, okay, I'll take this, right? Well, why are you giving me this? Why are we doing this? How's it going to affect? Are we just treating symptoms, or are we getting to the root cause? If you're not getting to the root cause, all you're doing is spending money and paying big pharma for a lot of stuff you don't need. Find out the root cause and be your own advocate.
I love it. I have a lot of questions on what we just went over. So one thing I want to point out, I know it, but can you speak to the effect of testosterone levels today in men versus 20 years ago?
Yeah. So, I mean, we're so much less, right? And I don't know, I'm not an expert in this field, and I don't know what the cause is. You hear all the stories, it's because they put this in our food, or they have all these chemicals, all their stuff. Whatever the cause is, it's greatly lower. So now we're seeing guys in their late 20s, early 30s that are needing HRT treatments to boost that up. And the numbers are all over the place. So some people say, well, if you're at 300, you're fine, but if you're below this, you're not, or this is way too much. How we gauge it is, all right, this is where kind of the range should be, but it's not that range. It's how do you feel, right? Yeah. Maybe your numbers are at 800, but you still feel horrible. Maybe your number is 1200. And that's what people need to realize is that, yeah, you may see somebody on social media, this is what I do, and this is great, and you need to do this. Well, that's probably not going to work for you. Our bodies react differently. They're treated differently. You can't get that same cookie cutter type thing. You've got to get the testing, right? And the numbers are important, but how do you feel? So if we do this and you still feel horrible, well, then that's not working. We need to do something else. And maybe there's something else that needs to be added to it. And we see it all the time. Hey, so-and-so's doing this. This is what I want to do. Well, that's maybe great for them, but that may not work for you. Let's figure out what's going on and look at lifestyle too. For tests, especially, are you getting enough sleep? Is your body recovering enough where your testosterone in the mornings is up where it needs to be? Do you have a horrible sleep cycle? Are you a shift worker, right? Are you up at night? So when you're supposed to be recovering, you're not recovering. What's your diet look like? Are you eating like garbage? Is that part of the reason too? So it's not just a one, oh, okay, here you go. Here's your testosterone. Good luck. It's more, it's a whole clinical process in getting to, okay, well, then let's get this tried. Because before I got on test, I spent 2 years working on like my sleep cycles and my circadian rhythm and my diet. And weight's a big thing too, right? If you're really overweight, that's a big problem when you're trying to get test replacement. So start doing lifestyle stuff first. Medications, even like IV treatments and medications and pellets and all this other stuff, that should be secondary once you get your lifestyle figured out. Because if you're living a lifestyle of total garbage, this stuff is not, it's going to help some, but it's not going to be your cure all. You got to get your lifestyle right. And the biggest ones are weight and sleep. You gotta get those figured out. So
That's awesome. I mean, I can tell you, sleep is a problem for me.
yep.
The weight, definitely not, but sleep for sure.
Sleep's a problem for a lot of people, right? It's a challenge. So even today, even as an owner of this company running, I still work my job at the fire department. And when I'm up for 24 to 48 hours at a time, right, my body never recovers. Then I'm home for a day, and then maybe I'm back on shift, or I never sleep at home. I get very limited sleep. So how do we combat that, right? And I've been doing a lot of the same stuff you've been doing too. Cold plunge has been huge for me. Red light therapy. I try and do all these other things. I don't take sleep aids. I don't do Ambien. I don't do any of that stuff, right? I want to try and naturally do it before I start medicating myself. So you got to explore all those options. But I'm with you on the cold plunge, especially for us older guys in our 50s, the recovery aspect, but more so now that I've been doing it for a while, the mental. And I wouldn't say like I'm a happy, gleeful person, but I'm more positive and I feel better throughout the day. So
Yes. I will actually, I want to second that because a lot of people think that the cold plunges, the physical benefits are massive. I'll be very truthful. I have not felt physical benefits besides I feel better and I'm a little bit more cut. And that could be from working out and diet. So it's hard to attribute where that's from. The biggest thing I've ever noticed with the cold plunge is my ability to handle stress and how clear I think through the day
yep.
when I do it. Big difference if I'm in there 5 minutes a day at 45 degrees, I feel great the rest of the day. And I try to do it every day. The days I miss, I'm more irritable. I'm not as sharp. I'm not as focused. So just the mental aspect alone is worth it.
Right. Absolutely. And I refer everybody, right? I don't want anybody to take my word for anything that I give them or show them or talk about, right? I mean, there are plenty of proven studies. I gear them a lot towards like Dr. Andrew Huberman or Dr. David Sinclair or Dr. Peter Attia, guys that really study this. They're really, really smart guys. I'm not a really, really smart guy, but I know how to find really, really smart people that can answer stuff a lot better. And it just validates what I'm talking about. So please don't believe me. Go out and do your research. And that goes right back to being your own advocate for your own health, right? You're going to pay for your health care one way or another. You're either going to pay for it on the front end by taking care of yourself, or you're going to pay for it on the back end by expensive hospital visits and medications and all this other stuff. So choose your pain. Either way, you're going to pay at some point.
I actually think it's more expensive if you wait. And here's why. Because you're dealing with those problems and you're having all these, you're not optimized, which means you're not having the same level of output. So since I've gotten into health and fitness and everything we're discussing here, I've also noticed that I'm running my company better. I'm earning more. My team's earning more. Why? Because I am completely dialed in.
Right.
If I wasn't dialed in, I would not be performing at these levels. Right.
Yep.
And I think you cannot put enough weight and value on that. Right. Think about it. You've done 75 hard. I do it every year. There's no logical reason why my highest earning period should be when I'm doing 75 hard, because I am much busier. But you know what? I can match it up every time I've done 75 hard or any of the phases. Very, very high earning period, even though I am busier.
Yeah, absolutely. And it really comes down to one thing. which I think everybody struggles with. And it's not so much motivation because everybody wants to do it, right? It comes down to discipline. Are you going to discipline yourself to do the right things that you know you need to do in order to live the lifestyle that you want to live? If you can't get that under control, none of it's going to matter. And that's why 70 Hard is such a great program, because you do have to discipline your time, because now all of a sudden I have all these other things that I have to make sure I get done, because there's no way I'm going to fail this. But then I still have to work. I still have a family. I still have a company to run, right? But I still got to get my 2 workouts in. I got to get my gallon of water in, the whole thing. So I just posted the other day about that. Somebody had asked me, oh, yeah, exactly. You're always so motivated. And I'm like, no, I'm really not the most motivated person. I'm just disciplined because I want to have a life and a lifestyle. And when I turn 80, I don't want to be that 80-year-old guy. Like, I've been in EMS for 26 years as a paramedic. I don't want to be one of my patients that I have to go see that can't even move, can't even function, can't do anything with their life, right? Because they've never made their health a priority. And I see it all the time. And the worst part about that is people that don't take care of themselves, then when I show up, then their big concern is, I don't want to go to the hospital. I'd rather die here at home because I can't afford what's going to happen at the hospital. Right. And I don't know what the answer to our healthcare system is, but I know what the answer for us is, and that's be preventative. Right. Again, be an advocate for your health. That'll pay you dividends for your entire life.
Absolutely. Can you take us through the process? So I call you up, Mark. I say, Mark, I want you to make me superhuman. Okay. Or I want to operate on an even higher level. Walk us through what happens. Because I hate sitting in a doctor's office. I won't do it. I just won't do it. I'll do my checkup, I'll do my blood work, and that's it.
Yep. So the process is really simple. You make the call. There's a quick questionnaire that you have to fill out, and then you're scheduling an appointment. And right now we have a national agreement with LabCorp. We send LabCorp an order. You go to like any Walgreens in the country and you do a set of labs. Those labs usually get back to one of our providers within 48 hours. They go ahead and they review that, and then they review your questionnaire. And this questionnaire is probably 3-4 pages long, and you get all that. So then now they've reviewed that, and now a telehealth visit is scheduled from that. Telehealth visit usually takes anywhere from 15 to 30, somewhere upwards of 45 minutes, depending on all the issues you have and what it is you're trying to accomplish. But then you sit down and you discuss that with the provider. All right. And it's all right. So what are your goals? What do you want to accomplish? Where are you at now? Where do you want to be? We really look at where do you want to be? Why are you not happy with where you're at? And a lot of that they can see right there in the labs. Well, here's why you're not happy. Here's why you're overweight. Here's why you're not feeling good, right? All these different signs and symptoms. Okay, and this is where you want to be. All right, well, this is where we start. So then they write either a prescription or an order or whatever it is, whether you're doing pellets or shots or however that goes. And then they start there. Then you're 30 days in with whatever they prescribe for you. And then you go and you do a return set of lab work. All right. They do that, 48 hours, they get the results back. And now you schedule another telehealth visit. All right. So how do you feel? This is where they're like, ooh, we're not even close on some of this stuff. Prescription needs a change. Or, hey, all your numbers look great. How do you feel? Are you feeling better? Do you have a better output in your day of productivity? Are you mentally feeling better? Are you happier? Are you liking what you're seeing? Can you work out longer? Stuff like that. And then based on that is like, okay, well, everything's great. Perfect. Then we keep going where we're going. If things aren't, then all right, well, then here's some of the things that we can tweak until we get you to where, you're considered, or we would consider you, optimized in your health and fitness, right? And I mean, it's obviously a journey, and then it's every 6 months after that. All right. So now let's relook at it. Right. And you don't need to use LabCorp. There's companies or people's insurance where they can get their lab work done for free. That's not stuff we make money on anyway. We just need that in order to get people started and get things figured out. And it's just progression from there. It's all right. Now we recheck, and now we see where you're at, and right. And hopefully, when we come back 6 months later, now we have a new set, and maybe things are a lot better. Maybe cholesterol's gone down, or your blood cell counts and things have changed. All of that stuff, it's all taken into account. So the process is really simple, and then it's just figuring out from there, and then maintaining, right? And it's not a one and done, right? People have to realize when you start HRT stuff, this is stuff you got to be committed to for the long haul. This is not something that, oh, hey, I did this and now I feel great. Look at me. It's, man, now we need to keep up with it. It's a progress and a progression through the rest of your life to keep yourself optimized. Is it easy? Yeah, I mean, it's fairly easy to do this stuff, but the right thing to do isn't always the easiest thing to do, right? So it takes that. And again, it's not that motivation; it's that discipline. All right, I got to do my shots. All right, I got to do my blood work, right? Because if you don't keep up with it, then the minute you stop, you're going to go right back to how you felt before. So, but then some of the things are able to change, right? You start living a better lifestyle, you get healthier, you start losing body fat. Some of those doses then come down. So where I started with my test shots and now where I'm at with the pellets that I take, it's a huge difference because I got myself in shape. I lost a lot of weight. I'm healthier because of it. And now I don't need as much because my body's producing some of it on its own that I wasn't doing before because I was a slug and I wasn't doing the right things to keep myself healthy. So, but again, everybody's body's different. It's all a process for everybody. What worked for me probably won't work for you or the next guy. You gotta regulate it yourself, and it goes back to you taking care of you and optimizing yourself and being your own best advocate for how you feel. Don't let anybody else tell you how you feel. You know how you feel. So
I don't want to say trial and error, but let's call it trial and adjust, and then trial and adjust, right?
Right. Yeah, that's exactly what it is. It rarely happens the first time where somebody gets dialed in with the first round of either HRT treatments or peptides or some of this other stuff. It didn't happen for me. It didn't happen for my wife. The majority of our patients that we see, it doesn't happen for them. And we let them know that up front. Hey, listen, this is a starting point, right? And that's why we do the blood work 30 days later and have another visit. All right, here's where we're at. How do you feel? Okay, let's make some adjustments. 6 months later, all right, or 90 days later, how you doing? Okay, let's make some adjustments. 6 months, I'm doing great, perfect. Maybe a year later, that's all changed. So it's a process.
I love it. How much do you think usually is picked up by insurance, or is it mostly just
insurance doesn't really pay for any of this? I've seen 2 people in the last year that insurance has picked up the cost of it because of other serious health issues, and it was something that was needed. But insurance, we haven't found anybody, and we don't take insurance because the minute we start doing that, then we got to start inflating our prices to cover what insurance actually pays out, which is pretty horrible. So this is something that it's pay out of pocket, or HSA for people that have HSA or FSA accounts. Mm-hmm. A lot of times it's always covered by HSA. FSA sometimes you have to have it pre-approved, but most of it's out of pocket expense for the patient.
Right. Which is well worth it, by the way, because I've been doing the NADs and some of these other things, and it made a big difference in how I operate.
It does. And there's a big push right now by a lot of these doctors that I had mentioned beforehand that are pushing to get age classified as a disease. And if they can do that, because right now age is just a process, it's not a disease. If it can be classified as a disease, then they can start writing prescriptions for this stuff, because now we know that there are hormones and peptides that help take care of that aging process, right? It's not the fountain of youth. You're not going to live forever, but you're going to live a longer, better, healthier, more functional life. So there's, they talk about these things. There's lifespan and there's health span. Lifespan is till you die. Health span is till you can't really function as a human, but you're still alive. But are you really still alive, right? If you can't do the basic things, if you can't enjoy your family, if you can't enjoy your retirement, things like that. So the goal is to get lifespan and health span a little more equal. Not that health span runs out here and now you're just a body taking up space until you die here.
Got it. And I'm going to wrap up with this question because we're over, but describe the pellets, because this is something that I would only do with someone I trust, like yourself.
Yep. So
I don't know about them.
Yeah. So the pellets, so there's hormone pellets that get placed. For women, they get placed in the butt cheek. For men, they get placed up in the flank, right or left side. So there's a lot of controversy. There's some people that don't like pellets at all. There's a lot of people that love them. So what pellets are, is they're The company that we use, these are built specifically for the individual. So based on how much testosterone and estrogen you need, are placed in these pellets. So women usually get like one, maybe 1.5. Men get up to 5, depending on the amount of tests that they need. But they're placed into the body. They use this little thing called a trochanter. There's a small 1 millimeter incision that's made, and then the pellets are placed in like the sub-Q area of the body. And then it's a little bit of glue, a compression dressing, and that's it. So no sutures, nothing like that. No long recovery. It's a quick, simple, literally takes 15 minutes to get all of this stuff placed and done. But then what happens is, again, this is based off your cardiac output and how the body grabs that testosterone out of there. So there's a lot of different companies out there that offer pellets. I'm not going to pro one over the other. We have a company that we use. We feel that they're the best in the industry. They've got a lot of data to back up why they are the best, but whatever really works for you. So, but then the body just naturally grabs, right? And then we do the same thing. Pellets are placed, and then we do a test to see 30 days later, all right, where are your levels at? And then there's another test 90 days later. All right, what do your labs say here? How are you doing? But that's the great thing about it is that I only have to do that twice a year. Pellets are placed, I can forget about it, and I feel great. And then I can start telling, I've been doing it long enough. I know, all right, at the 4.5 month mark, I'm gonna need a new set of pellets, and then make the appointment. We do the labs, we do the whole thing. I'm at a point now where I only do labs typically once a year because I'm pretty dialed in. I know exactly what I need. My provider knows exactly what I need. And it's just a really easy process. So, and it's to be able to do that in somebody's home. All they need to do is, like here in Denver, we bring in a little table. They lay down on it. Again, it's a simple small incision, a little bit of numbing, done 15 minutes later. And then that's it. And then there's other, peptides that go along with it, depending on what your goals are. So, I take a couple of those. Women get a lot of benefit off of taking like progesterone, low dose naltrexone, iodine, ADK, right? But again, it's all based on where your labs are. What one person needs, the other one doesn't necessarily have to have. But pellets for me, man, it's just great not having to think about doing a shot every 2 days. It's just simple and easy.
Yep. And this might sound like a goofy question, but just humor me here. Someone that is very, very active, right? Physical sports. If you put those pellets, on my hip,
yep,
and I go out and take a big hit right in that area, or I get a puck to that area, is there any risk there or no?
Now, typically, so there's usually either a 3 to 5 day period where, like for men, no twisting type motions, not a lot of bending over, and that's just to let the incision heal. For women, it's like no squats, no lunges, things like that, because you got to let that incision heal. But once they're in there, they're in there. They're not going anywhere, right? So they're now basically they're a part of you, and the body's grabbing what they need. So they're not gonna. I've never heard of anybody, having an issue afterwards. I've heard of clinics where they don't necessarily use the cleanest or most sterile procedures, and people have gotten infections. But that's just from improper technique or not using the equipment right. We've never had an issue with that, so it's not a problem. Typically, I can't say it's not a problem. We do all the right precautions to make sure it's not a problem.
Got it.
Yep.
So if somebody wanted to reach out, somebody wanted to ask you questions or start their journey on feeling better, getting better, looking better, what's the best way for them to reach you?
So the best way is to go through our website, HydraMed.com. You can put something, you can send a message. We have dispatchers that cover all the states. We can only work in the states that we're licensed to right now, which is Colorado, Wyoming, Tennessee, Florida, Georgia, and Texas. So that's where our medical directors are licensed at. That's where we as a company are licensed at, and we can operate as well. But if anybody had questions and just wanted to go over labs or get a little bit of information, or maybe, hey, this is where we could go, I could definitely get you pointed in the right direction. So HydraMed.com is a great place to go. Or you can email me directly, Mark, M-A-R-K, at HydraMed.com. I'll be more than happy to answer whatever questions. And if we can't take care of you, I'll find a provider in your area that I know will do a good job for you, and get you all set up.
Thank you so much. You absolutely crushed